Hi, in this video, I'll be talking about how you manage changes in your weight during breast cancer and its treatment. First of all, changes in weight during breast cancer treatment, that doesn't seem fair. So we see both weight loss and weight gain when people are undergoing treatment for breast cancer. And this can be really hard for people because their body image is already affected by surgery, loss of hair, just not feeling as good as one normally does. So this can be really hard. If you have a history of an eating disorder or disordered eating, as in our other videos, I would recommend you let your medical team know that and talk with a registered dietitian. Many of the tips I'll be giving you here could actually trigger your eating disorder, and of course we want to avoid that. So watch this at your own discretion and know that we're aware that people do struggle with body image and with their relationship with food. So what causes weight gain, which I'm going to focus on? There are multiple things that do. One is chemotherapy induces temporary or permanent menopause, which can be associated with hormonal changes, which can be associated with weight gain. In general, it's 2 to 5 pounds of weight gain that people will see. Another thing is if you are on oral contraceptives and then you stop them, we can see weight fluctuations. Most people actually lose a little weight when they go off oral contraceptives, but some people gain it. So that may also account for some of your change in weight. A few other things, we tend to do more stress eating when we're under stress. That's why it's called stress eating. We also have lots of people bringing us food because that's how we nurture each other in our culture. So people will bring you dinners and you'll want to eat when you feel good. You may also have certain cravings. If you've ever been pregnant, you might remember having cravings. Mine were for ice cream, which isn't particularly helpful if you're trying to maintain a stable weight. But you might also crave salty foods, and that can lead to retention of water. So you might notice that you're a little puffy and bloated. The other thing is, no matter how hard we try, and even if we continue working during treatment, our activity level goes down. Basically, the number of steps that we take every day tends to go down. And if your doctor has advised you to take some time off of work, it's really hard to get in that daily motion, the car, your parking lot to the office back, down the hall, dropping things off to people, or running to get the mail, the kinds of things we do every day. In our work at home environment, for some of us, we've already noticed that. And when people are going through treatment for any serious medical condition, they tend to have alterations in their routine. So you might have been somebody who was regularly going for a walk with friends or playing pickleball with friends on the weekend, and that routine tends to fall off. So a lot of these things can cause people to put on 5 or 10 pounds. It doesn't sound like a lot to many people watching, but for some people that's very worrisome, and they especially worry, is it going to continue? Will I be able to lose the weight? It can be really hard to lose the weight afterwards because of hormonal changes, and because after chemotherapy, for example, we put people on endocrine therapy like tamoxifen and the aromatase inhibitors, which can also alter the hormonal milieu or environment in your body. A side note about tamoxifen and weight gain: in randomized controlled trials, people who were on a sugar pill gained just as much weight as people who were on tamoxifen, and it wasn't a really big sugar pill. So the scientific community will tell you that tamoxifen does not cause weight gain. Doctors are really convinced that it doesn't, but many of us physicians also do believe it. Our patients come off tamoxifen and they drop 5 pounds with ease without even trying. So between you and me, I actually think tamoxifen does cause weight gain. We see a little less of that with the aromatase inhibitors, which can be used only in people who don't have functioning ovaries. So hormonal changes from chemotherapy, also from endocrine therapy itself, from changes in activity, from changes in diet, changes in routine. How do you cope with them? Well, first of all, you're fighting a culture that's fat phobic, a culture that wants us all to be lean, a culture that in magazines elongates the neck of the models and slims them down, where people considered beautiful are very skinny. Things are changing, but not fast enough. So recognize that your feelings about your body and your body image, if your weight changes, are culturally based. They're not just your own. They're messages you've had from when you were a child. You might be an exception, and that's wonderful. I know I'm not speaking to everybody, but the vast majority of people, especially women, feel that gaining weight is a no-no, and yet it can be hard to avoid. So consider being exceptionally kind to yourself. Consider finding ways to get some routine in your life. Routine is very good at helping us focus. It's very helpful in keeping us sort of clued in with the regular world, with the people in our lives. If people ask what they can do to help, instead of bringing over a meal, could they go for a walk with you after your dinner? It's good to have movement no matter what, right? It's not just to maintain your weight. It's also to be outside and to move your body, and remember that your body is strong and healthy, even though you might feel and look different. So we want to maintain your resilience and normalcy as much as possible, and staying active is one way to do that. You may find that you want to buy some more comfortable clothes if you're not working and not going out as much. And frankly, if you are, you should be comfortable in your clothes. And it's hard not to catastrophize and say, I'll never fit into my favorite jeans again. I would encourage you, if that's really important to you, to make that a goal. Maybe not during treatment, but soon after. The other thing you can do is have affirmations for yourself. And you can ask people around you to both validate your concerns about the change you're seeing in your body, and also give you permission to have your body change. Maybe you're underweight, and gaining a little weight isn't a bad thing. So I think being exceptionally kind and asking others around you what you need to deal with this potential side effect are key ways to get through this, along with those other tips like staying active and watching what you eat, not to excess. And again, if you have a history of an eating disorder or disordered eating, please be very careful with these tips and seek professional help. You might want to reconnect with your therapist or the program that's helped you in the past. I've covered a lot with you today, and I hope it's been helpful. If you want to know more about whether chemotherapy or hormonal therapy might be part of your treatment plan, visit Yerbba.com for your personalized report. If this video has been helpful, click like and subscribe, and feel free to drop us a comment below. We try to get back to you as soon as possible.